Hi, my name's Matthew. I'm a senior physiotherapist at myPhysioSA, and I'm here to talk to you today about persistent pain syndromes and ways that you can manage that. I currently work in partnership with the International Spine Centre, which is in Wakefield Street Clinic in the city, and also at the Hills Integrated Pain Team, which is in one of our Mount Barker clinics. I think the first thing to recognise with persistent pain is that it is real. But everyone's pain is different because there are so many facets that impact and contribute to a pain syndrome. So when we talk about persistent pain, we're really referring to any condition where the pain is present for longer than we'd normally expect for things to settle down in terms of the tissues or in terms of an injury. And the other thing about pain is that it is a conscious experience. In persistent pain syndromes, one of the challenges is that the nervous system becomes quite sensitized. And if I can borrow an analogy from a recent book called Rewire Your Pain to try to explain that sensitization, if you imagine a beehive, you always know a beehive is around because you can hear that buzz, that hum, and that's really what our nervous system is like. There's always a hum to it, and what's happening is our tissues are sending off information along the nerves, and then our nerves are receiving information and sending them back to the tissues, and this happens all of the time, and it's actually quite normal. Now, can you imagine then that someone comes along and whacks that beehive with a stick, and for a short period of time everything goes a little bit crazy and becomes really sensitized, and this gets wound up and becomes really alert. And this is the same thing that happens in our nervous system. So if something happens in terms of an acute injury, then our body is going to respond based on how much threat or danger our body feels like it's in. And that's a normal response that will cause our nervous system to become a little bit sensitized. And what happens over time is that sensitivity settles down and it goes back down to that normal, gentle baseline hum that is what we want in the nervous system. Now, sometimes with persistent pain, that nervous system can stay sensitized for longer than what we would hope it to be. And what we want to try and do is use management strategies to try and help desensitize the system and calm everything down. So please stay tuned for my next video where I'll talk a little bit more about some management strategies.